There are people still coming in. First of all, I guess I should start. I appreciate everybody coming down so quickly because I'm actually going to get some extra time. So I have photos at the end. If I don't get through the whole thing, or if I get through the whole thing, I can actually add some stuff on, which is kind of nice. If you have questions, let me know. These are all the real deal, by the way, if there's any questions. I always bring body parts just to kind of get you acclimated to what we're doing. These are all loaned to me from the medical school. This is a kidney. This is my very favorite. It's an ear. And I love the ear because if you look closely, if you get a chance afterwards, come up and check it out. You can see the guy's hair still is on his scalp, which I love. I love that. For those of you who have tattoos, they are forever. This is a guy's arm, and you can still see on the skin that there is tattoo on his arm, so you can check that out. This is from the shoulder to the elbow. For those of you who had health class, and you've already talked about ball and socket joints versus hinge joints, this is actually a great example. The shoulder, which is up the upper part, actually is a ball and socket. It looks like a ball and socket. The elbow, which you can see at the other end, is a hinge joint. You can see that. This is a full arm from the shoulder to the fingers with the skin taken off, so you can see all the arteries and nerves and all the muscles and how they all work. These are two lungs right here. This is a smoker and a non-smoker's lung. I'll let you figure that out. For those of you who are smokers, so cool. But you should check out and see what you're doing on the inside because that's the difference right there. This is a heart with the ventricle cut open, so you can look and actually see what the ventricle looks like on the inside, because in the books it's all smooth and perfectly clear. That's not the way it is in real life. So if you want to look up here, that's for you. And then this is a pancreas and a spleen. For those of you who have family members who are diabetic, it's the pancreas that's the problem, so you can have a look up here and see what that looks like. So we're going to talk about a lot of stuff. I talk really fast. Literally, this is for you. People ask why I'm here. I don't get paid to do this. I could be at home sleeping right now, but I come here literally for you guys. It's whatever you guys want to talk about. If you have a question, stick your hand up. I will answer the best I can. For those of you who've seen me before, I don't make stuff up. I'm willing to be honest with you just about anything you guys want to know, because this is your time. If you don't like gory or gross, this is going to be a long hour or so for you. So if you start to feel nauseous, like you're going to pass out, do not stand up. Just for the record, because you will pass out. It happens at least once a year. I get somebody pass out. If you feel nauseous, you don't have to watch it. You can put your head down, close your eyes, that kind of stuff, because there are some graphic pictures in here, but it's nothing that you guys can't handle. It's not that big a deal. I do this through a program called Erase. It's a bunch of ER docs get together before to try and prevent injuries from happening before they happen. We're going to talk about how one becomes an emergency medicine physician, what goes on in the department, and why you should care. I spent 5 years at elementary school, then 3 years of middle school, then 4 years of high school, then 4 years of college, and then 4 years of medical school, and then I did a 3-year residency at the University of Illinois in Chicago. If you want to do neurosurgery, this becomes 9 years, so it becomes a much longer course. Just so you have some sort of perspective, I was 29 when I was finished with all of my education, and I went straight through. A lot of people take time off between college and medical school to, I don't know, find themselves or whatever they do. I don't know, they take time off. But I went straight through as 29, so you have some sort of idea of how old you will be when you get done with all of this. I work at St. Vincent's Level 1 Trauma Center, although it feels more like a zoo. Turns out this slide is only for me. Nobody else finds this as amusing as I do, but anything that can urinate 20 feet, I think is awesome. I mean, think about that, 20 feet, really? I love that slide. It's just for me. It makes me happy. Sorry. I like what I do. It's a crazy job. I have all sorts of crazy experiences, but it's a lot of hard work, a lot of sleepless nights. That's not me, but I felt like that a lot. It's a lot of staying in and studying when everybody else is going out and having a good time. Business majors. Ha! You're staying in and you're putting a lot of stuff into your head to try and remember to get into med school and all that sort of stuff. So it's a long road. If anyone's interested in medicine, feel free to ask me any questions afterwards. I'll answer any question I can for you. Start with some simple stuff. This is a kid your age. He was playing basketball with his buddies. They got in a disagreement as to whether there was a foul or not a foul. So they started arguing back and forth. They started pushing and shoving. This kid lost balance from his own body height. He fell back like this, hit the back of his head on the hardwood floor, started becoming more and more confused. They brought him in to see me in the emergency department, and he was more and more confused to the point where all he could say is, my head hurts, my head hurts, my head hurts, my head hurts, my head hurts. He couldn't really answer any other questions. Didn't know who he was, where he was, anything else. Just my head hurts, my head hurts, my head hurts. Now we noticed something right away, which you may have noticed as well. There's some blood coming out of his ear. This indicates something called a basal skull fracture, which means not only is he bleeding on the outside, he's probably bleeding on the inside as well, which is why he's so confused. So I know this kid's in trouble, and he's going to get more and more confused, so I need to put this kid to sleep. Now, when I put you to sleep in the emergency department, I don't turn the lights out and gently rock you until you get drowsy and go off to sleep. I'm going to win. I'm going to win every single time because I cheat. I use drugs. I use heavy-duty drugs that I don't care how big you are, how mean you are, I am going to win. I'm going to put you down because I'll sedate you and I'm going to paralyze you. Now, if I sedate you and paralyze you, however, there's a risk to that because when you paralyze someone, it paralyzes everything, all of the muscles, including your diaphragm and your intercostals, which is how you breathe, which means I'm going to have to breathe for you. Now, if I'm going to do that, I'm going to use it through one of these things right here, this setup right here. This is called a laryngoscope. It's a little light at the end here, and I'm going to put that in your mouth like this, and I'm going to pull it up like that until I can see your vocal cords. And I'm going to take this little plastic tube right here, and I'm going to run it right down in there, and this is going to go in between your vocal cords, down about like that. And then I take this little thing out here, and I blow up the little balloon here at the bottom, like that. And then this stays in there, and I hook this end up to a little ambu bag you may have seen on TV. They're blue or purple or green or something. And we squeeze oxygen in and out of your lungs. We're physically breathing for you by pushing air in and out of your lungs. So we put this kid to sleep because he was getting more and more confused, and I was afraid he was going to hurt me or someone else. And you can see I put the tube here coming out of his mouth. We sent him off to surgery. Now, the neurosurgeons, they opened up an incision here in his scalp. They drilled 5 holes in his skull. They pulled the skull part off. They evacuated that big blood clot that was putting pressure on his brain because the skull's an enclosed place. If blood's going in it, where's it going to go? There's no place for it to push out. It has to push in, so it's pushing in on the brain. That's why he's more confused. So they have to take that blood clot out. They put the skull back on, sew him back up. He went up to the ICU. He was in the ICU for a period of time. Then they moved him out, and he had to learn how to walk and talk and do all that sort of stuff again in rehab. All of the pain, all the surgery, all of that over a simple disagreement as to whether there was a foul or not a foul. Now, if you paid attention when you came in here, this whole thing is called choices. I'm not here to tell you what to do. I'm not here to tell you what's right or wrong. I am here to provide the information to you about what goes on. Because you guys are going out on Fridays and Saturday nights now, and you're making a lot of decisions on your own that your parents used to tell you what to do or your teachers used to tell you what to do. Now you get to make those choices. But sometimes it's hard to make choices if you haven't seen a lot of stuff. So I thought it might be useful maybe to show you some things that happen to people and let you process it any way you want to. That's what I'm telling you. I'm not here to tell you what's right or wrong. I'm here to tell you it's all about choices. You can do anything you want to. You can do anything you want to, but everything has repercussions and ramifications. And so you have to think about whether it's worth it or not. In this case, they decided to bump, chest, push, and shove, and argue about whether there was a foul or not. And this kid ended up having surgery because of that. They could have also said, all right, man, you get this call, but I get the next one, and you alternate back and forth. It's all about choices. You can do anything you want to. This guy walked in looking absolutely stone cold normal. He was doing the ultra scary and dangerous task of changing a light bulb. That's it, changing a light bulb. But he was in a hurry, and after all, who's not in a hurry? It's a menial task. Nobody wants to spend any extra time if they don't have to. So he's in a hurry, and he takes the ladder out, and he opens the thing up, and instead of taking that 2 extra seconds to go click and locking those little rungs in place so the ladder is stable, he doesn't do that because he's in a hurry. So he opens the thing up, he climbs up the ladder, he starts doing the light bulb, and as he's turning the light bulb like this, it starts rocking back and forth. And it's not stable because the thing's not locked into place. The ladder tips over, he falls, he catches himself, hits his face like this on the floor, and he starts to have a lot of pain. So he comes into me because his face is hurting a lot, and as I'm examining him, it's pretty clear what happened right away because as I'm pushing on his face, it's going crunch, 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 crunch. I'm like, man, you broke your face. Which is a problem because just like if you break your wrist or break your ankle, it's going to swell. If you break your face, it's going to swell too. And the real problem is you get to breathe through 2 places, your mouth and your nose. That's it. And they're both in your face. So I know this guy's in trouble because I know that there's a lot of swelling that's coming. So I got to say, look, man, you know, although you look great right now, you're going to swell up and you could suffocate and die because of the amount of swelling that's going on. 100 years ago, this is a dead man. But today we have the technology to take care of this guy because I have these little plastic tubes, this endotracheal tube, because it is bendable. It's plastic, so it's bendable, but it's not really compressible. I can't really crush it down. So if I can get that in his airway, no matter how much swelling goes on, I know I can get air in one end and out the other. So if I can get it by all the swelling before it takes off, I can get air in and out of his lungs and he'll be okay. So I have to get this guy, I tell him, you know, we're going to put you to sleep. I put him to sleep. I use those drugs. I get him paralyzed. I put this tube in him. We get him up to surgery, and they do all sorts of repairs on his face, all the broken bones. He goes to the ICU. All the swelling goes down eventually. We take the tube out. He does fine. But all of that surgery, all of the pain, all of the time he spent in the hospital, all of that because he didn't take 2 extra seconds to go click on the rungs of his ladder. Now, you're going to have stuff your whole life that has safety recommendations, safety devices attached to it. They say wear goggles, wear gloves, wear a helmet, wear a seatbelt, whatever. You're going to have that your whole life, and you don't have to do any of them. There's nothing illegal about not clicking the rungs of a ladder. However, they're there for a reason. They're there because enough people have been hurt doing whatever it is they're talking about that they thought, hey, it's probably a good idea to warn people that we can screw you up if you don't do this. So you don't have to do any of them. I strongly recommend that you do. Now, I don't know what you guys know about drugs. And I'm fairly confident I don't want to know what you guys know about drugs. I know a fair amount about drugs, and that's because I either see a lot of drug addicts or because I've had to study a lot about it over the years. And what I've learned about drugs is very interesting over the years, is that while you're in health class, you're going to learn about the different classifications. You're going to learn about stimulants and depressants and hallucinogens. And that's all true. I want you to know all that stuff. However, that's not the way we in society really look at drugs. We think about drugs a little bit differently. We basically categorize it into two different categories. We think about the synthetic, scary kind, Dr. Ingalls, that I would never mess with. It's some creepy guy in a lab who makes these. I would never do that stuff. And then there's the totally okay because it comes from the earth and God made it and it's a plant, it's totally natural. And that's the way we really think about drugs. Now, I understand that. I understand the fact that just because it comes from a plant that we think, well, that must be safe because it comes from the earth. It's all natural. It's not a big deal. I don't want you to be confused. Just because something comes from the earth, just because it's a plant, does not mean that it's necessarily safe for us. So I wanted to give you a few examples of maybe some scary stuff that's not necessarily good for us that is all natural. Lightning, for instance, all natural, comes from the heavens above. It's beautiful, light up the sky, but it will fry you like a steak. It is not good for you, even though it's all natural. Arsenic and cyanide, these are two poisons that we used to use during the secret agent days to kill people. All natural ingredients, didn't have to do anything with them, but not good for you. This plant right here, lovely plant. Not only is it beautiful, it smells terrific. However, we grind this stuff up, and that's how we make rat poison. All natural ingredients, wouldn't recommend it, not good for you. And then of course, snake venom, all natural, wouldn't recommend it, not good for you. So I don't want you to be confused. Just because something's all natural, just because it comes from the earth, just because they advertise it on TV as all natural ingredients, does not necessarily make it better for us. You have to think about this stuff. Not everything is all good for you. If you guys not come across this yet, if you've not come across drugs, typically the way drugs work is you're going to be at a party. You're going to be at a hangout with your friends, and you're going to come across somebody that you kind of know, maybe not know so well, and they are going to present to you the opportunity to have your first drug of any kind for free. Your first round of any drug that you're going to want to try, your first joint, your first line of coke, heroin, whatever it's going to be, it's probably going to be for free. Now, they're going to pretend like they're hooking you up, like this is a friendship deal, and we're doing you a favor, keep it on the down low, we don't want anybody to know. They're going to pretend like they're taking care of you. But the reality of this is no different than when you go to Costco and you walk down the aisle and at the end cap there are those little old ladies with the white bonnets on and that little bowl of chips, and you walk by and go, "Would you like a chip?" And you take a chip. "Oh my gosh, it's delicious." They go, "I know," and then you end up buying a whole bag. You know what I'm talking about? It's a sampler platter. They want you to have your first round of any drug for free because they know something about drugs that you may not be aware. They are going to make you feel good. They're going to give you some sort of experience you haven't had before. You're going to feel like you're thinking and seeing things in ways you've never seen before. You're going to feel like if you spread your arms really wide, you can catch the wind and fly. Or for the first time in your life, you're going to talk to a flower, and the flower's going to talk back to you. You're going to have some sort of experience you have not had before. That's why people do drugs, because it makes them feel good. And they're going to want you to have that experience because they've given you this drug for the free, and they're going to want you to have a good time because they want you to come back. And when you come back, that's when they start to charge you. It's not the first time, maybe the second time, maybe the third time, somewhere in there, but that's when they start to charge you. That's when they start to get the money out of you. And they're very good at what they do because they know they make you feel good. Now the reality is, there's two things they're not going to tell you. They're not going to tell you about overdosing, they're not going to tell you about addiction, and they probably could. The reality is they could probably tell you that, hey, if you take this stuff, you could become addicted. But we probably wouldn't care. Because the reality is you turn on TV all the time and everybody's addicted to everything. Oh my God, I love chocolate. I'm so addicted to chocolate. Oh my God, I love shoes. I like buckles and bows and pumps. And those are not things that people are addicted to. And the problem with that is it kind of cheapens the idea of what addiction is. And so it becomes a problem because we don't think much about it. But I want to give you an idea of just how hard it is for these people that are addicted to get off of this stuff. So I wanted to give you a quick example. You all have an addiction to this nasty stuff called air. Oh yeah, so we're going to help you with this. What we're going to do is after school, we're going to go to your pool, your neighbor's pool, we're going to go to somebody's pool. I'm going to have you swim down to the bottom, and you're going to grab onto the grating, and I'm going to have you use your willpower to fight those cravings that you're going to have to take a deep breath. Now, the first minute or so, you know that's going to be a little uncomfortable. Because you've all held your breath before, and you know it's a little bit uncomfortable, but that's why we're fighting addiction. Of course it's uncomfortable, and you're going to feel terrific about yourself for that first minute. I'm fighting addiction, I'm doing so great. But it's going to become difficult, so I'm going to help you out a little bit more. I'm going to get 4 or 5 of your very best friends, I'm going to put them in scuba gear, I'm going to have them swim down to the bottom, and the entire time that you're down there using your willpower, they're going to surround you and cheer you on. And you're going to feel really good about that, and I'm going to help you even more. I'm going to get a very special episode of Dr. Phil recorded just for you, and the entire time that you're down there, I'm going to have these waterproof speakers down there, and you're going to have your willpower, you're going to have your support group around you, and you're going to have Dr. Phil in your ear going, I know you can do it, I'm so proud of you, I'm so proud you're doing so great, and you're going to feel really good. Until you get to about that minute and a half time. You get to about a minute and a half, things start to change. You start to feel a little bit uncomfortable, a little more than uncomfortable. Your body starts to talk to you a little bit. You know, this is great and all, but we could use some air. It's good, but we could really start to use it. And you're like, no, focus, I can do this. And your friends are still down there going, Dr. Phil's like, I'm so proud of you, you're doing so great. Now you get to about 2 minutes. At 2 minutes, things really start to change because you start looking at these people like, why are they down here in my business? This is really none of their business. This is me and my body. If I want to do this in my body, and they should be minding their own business. And I don't even like her, so I don't know what she's doing down here. And you're like, no, focus, I can do it. And your friends are still down there going, I'm so proud of you, you're doing so great. Now you get to 2.5 minutes. At 2.5 minutes, you don't even know these people exist anymore because all you can think about is everything in your body is starting to talk to you, going, we really need to breathe. And you're like, man, maybe I could start doing some things like if I point, they would look, and I could swim to the top and take a breath, come back down. You're like, no, focus, I can do this. And your friends are still down there going, I'm so proud of you. Now you get to 3 minutes, 3.5 minutes. At 3.5 minutes, you don't know anything else on the planet exists. All you can think about is, I gotta breathe, and you're fighting as hard as you can. You're like, no, I can do this. Your friends are still down there going, I'm so proud of you. 3.5 minutes, 4 minutes, 4.5 minutes. At 4.5 minutes, I don't care who you are, you're going to let go of that grating, you're going to shoot yourself to the top, and you're going to go, because that's addiction. It's not, oh my gosh, I'd like some chocolate. It's, I have to breathe. That's what these people experience, because when you become addicted to something, your body chemistry changes to the point where you need that stuff like you need air. That is why, if you want a simple example of this, anybody know anybody that smokes? In the wintertime, where are they? It's 30 below zero, freezing rain, sleet, hail, snow, and they're outside getting some fresh air. Who does that? It's freezing outside. You can't smoke inside, but they've got to do that because their body is telling them they've got to breathe. So they go outside and they freeze and breathe outside. That is cigarettes. Imagine if we're talking about heroin. If you've not seen heroin, by the way, it comes as a white powder. It can be a brown powder, but it comes as a white powder. And like I said, you're going to get your first round of any of this stuff for free. Now, if we're talking about a business deal, it's pretty easy to understand overdosing if you really think about it. It comes as a white powder. And this is a guy who's trying to make money. He gets a baggie that's about this big. Now, he's trying to make some cash, so he's going to mix it with a little talcum powder, maybe a little powdered sugar, maybe a little cornstarch, maybe a little baking soda, all of which are brown or white powders that you can't tell the difference. And if he mixes that in there, he gets a bag that's this big, and now it's this big. And he can cut that up and sell it to you in the many ways that it's found. You can see all sorts of different types here. And he can sell that to you. Now, the problem is, he's got more product to sell, but you have no idea how much of that is drug and how much of it is talcum powder and all the other stuff. So it becomes tricky because it's not like when you go to pharmacist Bob at CVS and pick up your penicillin, take 500 milligrams 2 times a day, avoid the sun, take with dairy. All that stuff has been measured out and told you exactly what's in it. When you have your strep throat, that's very easy. That's not the way this works. You're getting it from some dude who's probably high himself going, no, dude, that's about right, do that. Based on what, man? It's a guess every single time. And if you'll notice, there's no small, medium, and large here. They all come the same size. So if you're 350 pounds, a middle linebacker, a big dude, you're going to get the same amount as a young lady who's maybe 95 pounds. Well, that's a big deal. That's how people overdose, because you never know exactly what's in it. And heroin's pretty tricky. Heroin, of all the drugs that are out there, it's making a huge resurgence. Everybody in the news is talking about it. I've been doing this for 20 years. I've been talking about it for 20 years because it's been a problem for us. It's just got onto the news here recently. And the reason is because the way people get hooked up on heroin has changed. It used to be that people would do different drugs and they would try different, and they would end up in heroin because it made them feel good. The way heroin works, by the way, is it blocks the pain receptors in your body. It blocks all of the pain receptors in your body. It is the earth-shattering, bone-shaking kind of a sensation. Now, having said that, it's very quick to become addicted to this stuff. Am I clicking? And it's very powerful stuff. And so that's how addiction becomes a real issue for these people, and they can't get back off it. People don't get addicted the same way now as they did then. The way people get addicted now is very different, because what happens now is they start with legitimate means. They break an ankle, they tear an ACL, they get surgery, and then they get their Vicodin, or their Norco, or their Percocets. And then they go home and they have their limited amount, and their body starts to acclimate to this stuff when you start to get addicted to it. And now what do you do when they cut you off? Well, you may buy some on the street, but they're really expensive. Or you may steal some from your friends. Or you may borrow. But your doctors are not going to give you an unlimited amount of these pain medications. And so what do you do when you become addicted to it? Well, this is the same stuff. And so people end up using heroin because they become addicted to pain meds. Now, I'm not telling you if you break your ankle or tear an ACL not to use those pain medications. But I am telling you to be careful, because that's how people get hooked these days. You need to be careful, get off of it as soon as you can, and use just the minimal amount that you need to use. Because that's what happens to these people when they get up on the heroin. Heroin is dirt cheap, and it's everywhere. I promise you it's in this school. I work in Indianapolis, and I know all the high schools around there. It's in all of the high schools, and I know that because I take care of the students that come in that are overdosing. I know it's everywhere. You can find it. It's cheap. But I want you to be very careful when you start messing with this stuff, because you don't exactly know what it is. And when people overdose on heroin, they don't remember. It's not like when you drink alcohol and the next day you wake up and you're like, oh, my head is killing me. Oh, man, you feel terrible the next day. When people overdose on heroin, they fall asleep and stop breathing and die. That's it. You find them blue somewhere. And the problem is, you've heard about Narcan, the drug that people use to reverse it. The medics have it and the police have it and all that stuff. They can reverse them, but they don't remember, because they basically lost consciousness and then woke up in a hospital. And I had a guy probably 3 weeks ago. I had a 2-hour argument with him of the fact that he almost died in a Don Pablo's restroom stall. It was 3 in the morning, and he was shooting up in the bathroom, and he was fortunate enough that somebody was outside washing their hands when he overdosed, and when he fell off the toilet, they heard the thud, called 911, they turned him around with this Narcan, brought him to me, and then he got to argue with me for 2 hours. No, I was just really tired, man. You know, it was just a really long day. I'm like, no, you were blue. Not the same thing. You were dying, and you almost went out next to a public toilet seat. Not the glamour that you think about in TV and movies. This is what happens in real life, is overdosing like that, because they don't know exactly what they're getting. They don't know how much to use. Now, if you don't know much about how people use heroin, they usually shoot it. You can snort it, but they usually shoot it. They melt it down in this little spoon right here, and then they put it up in a syringe and inject it. Now, at this point, most of the room goes, oh, well, cool, Dr. Ingalls, I'm totally fine, because I'm not going to ever mess with heroin because I hate needles. Just so you know, I have yet to meet a heroin addict who doesn't hate needles. Everyone hates needles. Needles hurt. Nobody likes needles. However, if you're willing to stand outside in a snowstorm to smoke a cigarette, imagine what you would be willing to do to use a drug that has addicted you, that blocks every pain receptor in your body. A needle is nothing. They'll do whatever they got to do, because again, this is not, I'd like some chocolate. This is, I have to breathe. This drives them to do this stuff because it's what they have to do. Now, when I was in med school and residency back 100,000 years ago, there was actually something called the heroin look. It was what all the supermodels wanted to look like. It was, Kate Moss was the quintessential example. It was all these tall, skinny girls with really dark eye makeup and long, stringy hair. And everybody thought this was super sexy, and everybody wanted to look like this. This is what they all, now I thought it was strange because I thought they just needed a sandwich and a shower. But this is what everybody thought was super sexy. And it was not at all what I was seeing as the heroin look. What I was seeing as the heroin look was something very different. Now, most of these pictures of my patients are taken, by the way, with consent, but most of them are taken with a little disposable camera when I was a resident in Chicago. So they're a little out of focus, a little off center, but they're all the real deal and people I've taken care of. I saw this lady about every 3 to 4 weeks during my residency. And she would come in the same every time. And if you look here on her arm, you can see these lines on her arm. These are called track marks. You get this from shooting up over and over again. All that talcum powder, powdered sugar, all that stuff is very caustic to the vessels. So when you inject it into the arm, it kind of burns up those vessels, scars them down, and you can't use the same spot over and over again. You have to move on. You have to find a different spot over and over again. And so if you go long enough, you can chew up the vessels, all of these different vessels, and she had used all of her vessels where she couldn't use her arms anymore, she couldn't use her legs anymore, and she had to do something called skin popping. Now, skin popping is based on what a diabetic will do. A diabetic gets a clean insulin needle, They will clean off the skin with an alcohol swab. They will inject it underneath the skin, and then they will throw that needle away. And then the next time they'll get a new needle, clean it off the skin, inject, and that's how they take care of, get their insulin in their body. Now, skin poppers will do basically the same thing, except they're not going to use alcohol swabs because while you can buy those in a store, they cost money. And you could spend money on the alcohol swabs, or you could spend it on the junk. No-brainer. They're going to spend it on the heroin. They're not spending it on alcohol swabs. So they may start out that way, but eventually they're all going to give up the alcohol swab idea. And the other thing is they're not going to be able to use new clean needles every single time because you don't get a prescription for needles when you're a junkie. You get a needle that you may find somewhere, and you're going to use that bad boy over and over and over again until it cannot be used anymore because it doesn't work. Or you're going to share it with friends, and you're going to let them borrow it, or you're going to borrow somebody else's needles, which you hear about all these HIV outbreaks and all that stuff. It's all because needles are not openly available. So if you find one, you're going to use that bad boy till you cannot use it anymore. So that's basically what she did. She had decided she was going to start skin popping, and she was skin popping on her legs. Now, she was unique because she had lost everything. I learned a lot about drugs, actually, from her because I saw her every 3 to 4 weeks. She would come in with this sort of problem. And the problem was that she had lost everything. She had lost her family. She'd lost her friends. She had lost her jobs because when you're a junkie, really all you care about is when the next time you're going to get high because your body starts to tell you you need to get more stuff. So you don't worry about deadlines, you don't worry about hygiene and that kind of stuff, so you tend to not hold jobs very well. So she had gotten fired, and the only thing she could do to support her drug habit was to prostitute herself. And she prostituted herself using that Britney Spears Oops, I Did It Again video, you know what I'm talking about, where they do the pigtails and the miniskirt, and then she wore knee-high stockings. And the reason that's important is because she had figured out that she could skin pop on her legs and use the knee-high stockings to cover that up. And that worked until she would get these nasty little skin infections that would form abscesses, and when the abscess erupted and the pus came out, it smelled. Not good for business. So she would come in to me, and she would come in with one of these new little bad boys, these little pus pockets on her leg, and we would do the same song and dance every single time. Every single time I would say, look, we can bring you in, we can help you get off of this stuff, I have ways to help get you off this stuff to try and help out. She would say, no thank you. She would ask for a food tray, because she hadn't eaten for quite a while, so we'd get her a food tray that she would demolish. I would spend lots of time with her trying to find an IV site on her, because keep in mind, she had burned up all of her vessels. That's where we start IVs. So I didn't have a lot of options. So I would shave a part of her scalp and maybe get one in her scalp. I would sometimes get one in her neck. And I would get an IV in her. We'd finish an IV antibiotic. She would finish her food tray, and at some point during her visit, she would just disappear. No idea where she went, but we'd find the IV on the bedside and she'd be gone. And then 3 or 4 weeks would go by, she'd come in with a new one of these little bad boys, and we would do the same song and dance all over again. And she did this about every month or so until the last year of my residency, she stopped coming in. Which means one of two things. Either she went through all of the withdrawal and all of the daily struggle that it is to stay off of this drug, or she died. Because really those are your two choices. Once you start messing with drugs, again, I'm not telling you don't use, but I want you to understand exactly what you're dealing with when you deal with this stuff. Once you start, there's two options. You're either going to go through all the withdrawal and all the hardship to stay off of that stuff and get clean, or you die. It's either too physically hard and demanding on the body, or you overdose, or you do something stupid while you're on it. It's one of those two options. And again, don't believe me because I'm saying it. I want you to look for yourself. There are not a lot of 85-year-old cokeheads in the world. There's not a lot of 75-year-olds smoking weeds. There's not a lot of 65-year-olds shooting heroin. You may find one on the internet somewhere, but boy, there are not many of them. You don't usually make it that far. This is your choice. This is your body. This is your one go-around. The beginning of this is all about choices, because that's really what it is. You can do anything you want to in this life. However, everything you do has consequences and repercussions. And it's your choice. Is it worth it to you? That's what you have to think about. And if you let it go long enough, my guess on her is that she probably died. And I say that because I tried to get her clean every month for 2.5 years, and she wouldn't do it. So my guess is she probably died. Now, I don't know that, but that's my guess. Now, if you let these little things go long enough, you end up with something like this. This is a different guy, same sort of thing. He was a skin popper. You want to get some orientation. This is his foot, that's his shin, there's his knee, that's his thigh. This is all infection. That's all rotten flesh. It smelled like you would not believe. It was stinking up my emergency department. I had to put him in an isolation room because he was smelling the whole place out. His clothes were basically ruined because it kind of oohed and gooed, so his pants were matted to his legs, so I had to cut his pants off just to have a look at what this is. He hadn't been able to walk on this for several weeks because every time he put pressure on it, it hurt too badly. So he didn't walk. Now, the interesting thing is he came in, and the very first thing he said to me when he walked in the door, well, he didn't walk in, he rolled in. The first thing when he rolled in the door was, "I'm going to lose my leg, aren't I, Doc?" "Yes, you are." And he did. We took his leg off here above the knee. And the reason is because it was already infected all the way from the skin down into the bone. Now, you probably don't know much about this, but if you get an infection in your skin, I can probably take care of that. Few exceptions, but I can probably take care of that. If that infection gets down into the muscle, that's a little bit more complicated. Probably some surgery, a little bit more complicated, but we can probably take care of that. When an infection hits the bone, it's coming off. There's a very few exceptions to that, but for the most part, it's coming off because antibiotics don't really penetrate bone for some reason. It just doesn't work very well. And if I don't take it off, you become septic and die. So we had to take this guy's leg off here above the knee. Now he knew, the interesting thing is he knew it was coming off. That was the first thing he said to me, "It's coming off." He knew it was coming off, and it started with a little bitty pus pocket like that lady had. It started with little bitty. And I asked him, "Man, why wouldn't you have come in when it was this big and I could have taken care of it?" And his answer was really the best explanation I can give you about the power of these drugs. It's the best thing. He said to me, he knew how hard withdrawal was because he had enough friends that had gone through it, that he knew how tough it was, and he wasn't sure that he was strong enough to handle it. So he didn't. And he didn't come in earlier because he knew we wouldn't let him use drugs in the hospital. So he literally took it as long as he could possibly take it. And when he couldn't take it anymore, that's when he came into the hospital for us to take off his leg. If you think about that for a minute, he chose his drug over his leg. Now, I don't know about you guys, but I'm fairly fond of my legs. It would have to be something pretty intense for me to choose that over my leg. But that's what we're talking about. Again, I'm not telling you don't use. But I want you to know exactly what you're messing with when you start to mess with this stuff. It's choosing legs over drug, or drug over leg. That's how powerful this stuff is. Party time. Now, if I talk about drugs, people don't want to talk about the most commonly used and abused drug in America, and that's because we're not supposed to. That's because billions of dollars with a B are spent to make sure we don't think of alcohol as anything other than Diet Coke you can't drink until you're 21. Right? I mean, we don't think about it as a drug. We think about it as Diet Coke you can't drink until you're 21 because some old guy somewhere said that, you know, you have to wait until you're 21 till you drink it. It's really not any big deal. They're very good at what they do. And it's not really our fault. It's because billions of dollars with a B are spent to make sure we don't think of it as a drug. We're not supposed to think about it as anything really at all. If you think about it, the advertising campaign is genius. This is the only recreational drug in America that can advertise. Think about that. There's no Carl's Cocaine Shack, come on down, best prices in town. There's none of that. The only one, even if you go to Colorado where you can smoke weed legally, it's still not advertised. You can't advertise it. This is the only recreational drug that can advertise, and that has an impact on the way we think about it. And the way that they advertise is different than any other product. Again, don't believe me because I'm saying it. I want you to watch for yourself and see if I'm not telling you the truth. It's the only product on TV that does not advertise the product. If you turn on TV, there's an advertisement for a guy who takes a screen door and he sprays this black stuff all over it. He takes it, he cuts out the bottom of a boat, he puts the screen door in the bottom of the boat, he runs it out in the water, he's like, "Look, I'm not sinking," and you go, "Oh my gosh, that is great water sealant, I get it." You know what I'm talking about, right? Yeah. Right, you've seen that. You know exactly what that product does. If you turn on the commercial and there's a beer commercial on it, it makes no sense. A dude walks into a party and he goes, "Here we go," and a dog brings him a beer. Now, what have we learned? Well, that I want that dog. I mean, it's a great dog is what you learn. But we know nothing about the product. They're geniuses. They don't even have to make sense. And it's not because they're some sort of wizards. You know why? It's because they ask. Because they spend billions of dollars. They get women from 19 to 25 into a room and they ask them, what turns you on, what turns you off, what do you like, what do you think is funny, what do you not think is funny, and they turn that into a commercial. And then they get guys in a room from 19 to 25 and they ask them the same things, and they turn that into a commercial. They know what we like, they know what makes us laugh, and they don't want us to think about their product. All they want to do is entertain us. They want to have some sort of positive feeling with it. They want you to make you feel good, make you laugh, make you cry, some sort of positive association with their product. Watch for yourselves. Check it out. They don't tell you about their drug. They They tell you about how good it's going to make and how much fun you're going to have at a party. They don't even have to make sense. They had a commercial not too long ago. It was a rock concert on the top of this beautiful snow-covered mountain. And everybody there was spectacular looking. All the women had perfect bodies. They're running around in bikinis. All the guys had perfect bodies. They have no shirts on. They're all ripped up. They're all running around drinking, having a great time at this. And at the end of 30 seconds, slogan of the company, next commercial. And you watch that commercial and you go, it's totally awesome. I like that. I can go to that guy. That's a good time. Now, if you think about that commercial for a second, it all breaks down. It's a rock concert on the top of a snow-covered mountain. Who has a rock concert on the top of a snow-covered mountain? How are you getting everybody up there? I mean, rock concert's like 30,000 people. Are they going up 8 at a time in the gondola? Are we going up 2 at a time up a chairlift? Are we flying them in and dropping them out of helicopters? It's the top of a mountain. So how are you getting everybody up there? And by the way, if they're drinking beer, which by the way is a little bit of a diuretic, so it's going to make you pee, where are they all using the restroom? It's the top of a mountain. There is no place to use the restroom at the top of the mountain. So I guess they're all peeing in the woods. And how come everybody there is spectacular looking? Have you ever been to a rock concert? Not everyone is spectacular looking. That's not the way that works. There's usually a tooth to tattoo ratio you can actually calculate at most of these rock concerts. So it doesn't even make sense. But that doesn't matter. You're not supposed to think about the commercial. You're supposed to look at it and go, oh, pretty people. I like pretty people. Next commercial. If you think about it, it doesn't make sense, because the reality of that commercial is there's about 10,000 people at this rock concert, because the other 20,000 are still at the bottom of the mountain waiting in line to get up there. The ones that are up there are half of them dead blue in the middle because they've been running out at a snow-covered mountain with their bikinis on, so they're hypothermic and dead. And the rest of them smell like urine because everybody's peeing in the woods. That's it, I'm going to get letters now. I'm going to get lots of letters. Right? So this urine-smelling concert with half the dead people, that's the real commercial, but they're not going to show you that. They want you to look at the pretty people running around in this unreal world. So you have to think about this differently. I want you to watch these commercials and ask yourself, have they taught me anything about what I'm seeing, or are they just trying to make me happy? Because they're just trying to make you happy. And they're very good. They're already inside your head. They're so good, you have thoughts in your head that you didn't even know you had. If I were to take my shirt off and show you my ripped up abs, this is me. Rude. This could be me. It's not, but it could be me. If I were to show you my ripped up abs, there's a name for this. We call this something. There's a slang term. You know what do we call this? Six-pack abs. Six-pack abs. Now, as I say that, I can see you counting. How many rectus abdominal muscles do we actually have? 8. We have 8 rectus abdominal muscles that we call six-pack abs. Now, how does that happen? Well, it could be that some really cool kid one day who's not so good at math sees his buddy take his shirt off and go, six-pack. And it sweeps the nation. Or it could be that they spend billions of dollars a year with a B to associate alcohol and health. Because the new big thing is the low-carb beers, right? Everybody's talking about low-carb beers. So much better for you. Really, it makes no sense at all, because low-carb beers, no vitamins, no, I mean, there's nothing. Now you have less calories. So if you're working out, which you want to replenish and get calories, now it doesn't make any sense at all. But they're trying to associate this stuff with health. And they're so far in our head. Now, this sounds crazy, right? Except, how else does it happen? And let me take this even a little step further. Let me get a little bit more crazy. They do sociology studies called word association. Have you ever heard of that? Word association? Word association is where somebody will say one word, and you're supposed to respond without thinking the first thing that pops into your head. And what that tells us is how we're hardwired. So what it tells us, if I say pencil, you say pen. If I say desk, you say chair. If I say rutabaga, you say yellow. Whatever you say. I don't know what you say. But whatever it is, it tells me how you're hardwired. If you put six-pack on one of those studies, do you know what people respond? Beer. Beer. We're hardwired to think six-pack, beer, which means every time you see it or you hear it, subliminally in your head, you're connecting it with alcohol. So what that really means is every time you look at this and you think six-pack abs, you are associating healthy abs with beer. Subliminally. That's how good they are. And what's fascinating about it is if you drink a lot of beer, you don't get six-pack abs. Well, I mean, unless you cheat. Technically, I guess that is six-pack abs. But that's not what you get when you drink a lot of beer. When you drink a lot of beer, you get the beer belly. Oh, it's hot. You'll see a lot of other, how you doing? You'll see it. It's out there. That's what you get when you drink a lot of beer. But you don't see this guy on the ads. Bud Light, get you some. You know, you don't see that. You see this guy playing volleyball talking about what a great time it is. Hey, buy Bud Light. Right? That's what you see. They're very good at what they do, and they're so inside your head. Do you guys know about Indiana Lifeline Law, by the way? All right. If you don't, I want to hit this because this affects you right now. This is a law that is designed for you, not me, doesn't help me at all. But the Indiana Lifeline Law was passed in 2012, and the reason was because since 2004, 24 high school students had been killed by alcohol overdoses. Every single one of those kids could have been saved. All we needed to do was get them to a medical professional. That's it. But they didn't. Because as you can imagine, everybody at that same party where these kids were having their good time and drinking way too much and ending up dying, everyone there was drinking too. And nobody wanted to get in trouble. So instead of calling 911, they kind of waited until it was too late, and then they called 911, and then the kid died. And the legislatures looked at this and said, this is really stupid. We're losing kids because other kids are afraid to get a ticket or a fine, or whatever it is. So they changed the law, and they designed this law called the Indiana Lifeline Law, which says that you, as a minor, at a party, if you are worried about somebody's medical health and safety, and you think something needs to happen because you're worried about this kid medically, you cannot be ticketed, you cannot be arrested in the state of Indiana, even if you have been drinking yourself, if you do three things. If you call 911, if you stay with them, because there are sometimes some things that happen to them that we can talk you through. Say they start vomiting, we can talk you through a chin lift, we can do some stuff like that to keep them alive until the medics get there. And lastly, provide some information when the medics get there. Who is this kid? What did they have to drink? How much? Did they have any drugs? Did they fall down the stairs? Did something else happen to them? So that we know how to take care of them medically. If you do those three things in the state of Indiana, you cannot be ticketed, you cannot be arrested, even if you are intoxicated yourself. Now, everybody always asks, well, what about Dr. Ingalls? What about everybody smoking weed? The law does not specifically cover marijuana. However, we're not checking drug screens on people. Because our concern is this kid that's in trouble. We're not doing screens on everybody that's there. We're not doing alcohol tests. But it is not actually in the law, although they're working on that, and they're going to try and amend that. But it is not right now. It is not explicitly there. However, having talked to a lot of law enforcement officers, they're not worried about that, because what they want to do is take care of this one kid that's in trouble. The other thing I get asked is, what if I'm not the one that called 911 for this kid? Am I in trouble? The way that the law is written, it's the one person, but the way the law is enforced is that if you are a part of the solution, they're not worried about you. If you're part of a problem, they're worried about you. What I mean by that is if you're there helping this kid, if you're not providing any difficulties for the police or for the medics who are trying to take care of this kid, they're not worried about you. Go home, be safe. But if you're the kid in the back that's going, you took so long, you pigs, this kid's gonna die. I can't believe it took you so long. And you're disruptive and causing a problem, they will arrest you. Because you are causing a problem, you are preventing them from taking care of this person, they will take you out. So if you are part of the solution, they're not worried. If you are part of a problem, they will arrest you. Because that's interfering with what they want to do. Now, that's, in a nutshell, the Indiana Lifeline Law. Does everybody understand that? Are there any questions? Because this is your law. I want you to understand it. Oh, by the way, this is an Indiana law. My son goes to Michigan. My daughter is going to go to Florida. So you need to check the state laws wherever you go to school when you get to that point, because it varies from state to state. Michigan does have a law that provides the same sort of protections. But when you go out of state, you are not protected by an Indiana law. You have to make sure that that's applicable, or they have a similar law in the outside state. Are there any questions about that? Nobody? Silence? I'm that good? I nailed it? Oh, love it. Yay for me. All right, party time. So, there's two things I want to talk about with alcohol, by the way. Again, I'm not telling you don't drink. You can drink if you want to. You turn 21, it's totally legal. But I want you to understand what it is. There's two things. One is I want to understand that it's a drug. And secondly, I want you to understand how it works. So let's start with the fact that it's a drug. The first guy I'm going to show you here is a homeless guy who is an alcoholic in the city of Chicago. He comes back after drinking all day and he passes out. Now, passing out is an interesting term, because when you hear somebody passes out, you will literally hear people say, let him sleep it off. As though they're blissfully resting until the next day arrives. When someone passes out, they're not asleep. They're unconscious. Totally different ballgame. When you were a kid and you had a vomiting and diarrhea bug and you'd been puking all day and having diarrhea all day, and you said, Mom, I'm going to bed, and you went upstairs, did your parents ever ask once what position you were going to sleep in? No, because you're going to sleep. you can still protect yourself. You can still wake up. If in the middle of the night you start vomiting, you'd go, Mom! And you would get up and be fine because you're just sleeping. If someone passes out, what position are you supposed to leave them in? On their side. Right, and why is that? So they don't choke on their own vomit. Think about that for a second. That is not asleep. That is unconscious. That means that they're on their back and they vomit. Bleh. And it sits there in the airway till the breathing reflex kicks in and you go and suck all that stuff down into your lungs. Now you suffocate and die, or at least get a really bad pneumonitis in on a ventilator and in the ICU if you survive that. That is not someone who's asleep, who's sleeping it off. That is someone who is unconscious. It's a totally different ballgame. So this guy's been drinking all day, and he comes back and he passes out in this abandoned warehouse. Now he's fortunate because it's Chicago in the wintertime, and he's found, bless you, he's found an abandoned warehouse that still has the heat hooked up. Now the way it works is a radiator system, and if you don't know anything about radiator system, it'd be a big room like this, and then in the corner there'd be this metal hot thing that gives off heat, a radiator. So he comes back after drinking all day and he passes out. Only this time he passes out like this. Up against the radiator. Now again, if he's asleep, it would be, oh, my face! And he would pull himself off and be okay. He is not asleep, he is unconscious. And so instead it is, and he sits there burning his face until two other homeless guys in the same building smell the burning stench of skin, which by the way is horrible. If you've not smelled it before, it's not pleasant. They find him, they pull him off and bring him to me, and what I get is this. A guy with half of his face burnt off. You can actually see where the hot metal came in contact with his face. Now, if you look, his right eye, by the way, is totally gone. No idea where it is, but it's not there. And I know because I looked. Yes? It was a radiator. It was up against the metal part of the radiator, so you can see where he got all up against the metal. It's like a perfectly delineated line of where the radiator was on his face. So if you look, he burned half of his face off. His right eye is totally gone. Another view, if you look here, his left eye is completely opacified. It's kind of like if you take an egg and you crack it open, it's got that clear jelly stuff inside. Well, inside your eye is this clear jelly stuff. If you take that same egg and you put it in boiling water, it becomes hard and white and opaque. That's what happened to this guy's eye. His left eye is completely opaque, so he cannot look out of his left eye. He's completely blind in his left eye. His right eye is totally gone, and half of his face is burnt off. This is alcohol only. I know because I check. This is what I do. When you come in and say you've been using this drug or that drug or whatever, that's great. That's where I start, but I don't stop looking just because you said it. I don't believe any of you. I'm going to check it all out. I look for all of it. There is nothing else on board. This is alcohol only. You may think all sorts of things about it being Diet Coke, but it's a drug, and it's a powerful drug that does this kind of stuff. And I'm not saying you don't use it, but I want you to respect it for what it is. It's a drug, and it's a powerful drug. So my moral is, don't drink and fly. Oh, come on, that was good. Nothing? I get nothing? I'm trying to lighten it up. Everybody's so serious here all of a sudden. I got all serious. I looked hard for something like that. I love that, by the way. It's seasonal humor. That's the best I got. All right. I try to lighten up. I'll get away from preaching. We'll do a little bit more fun. We'll do something lighthearted. We'll do something different. Thank you. This guy I'm going to show you thought he was the biggest, baddest man in Chicago. And the reason he thought he was the biggest, baddest man in Chicago was because he had a shotgun. Which, by the way, if you have a shotgun, I'm on your team. I don't know what we're playing, but I'm with you, just for the record. But this guy had a shotgun, and he and his buddies had this really cool piece of sidewalk that they really enjoyed. And these other guys come along, and they also really enjoyed this cool piece of sidewalk. And they started arguing as to whose piece of sidewalk this was. Now, of course, they called it turf, but it's sidewalk. So they're arguing over the sidewalk and to whose sidewalk it is, and somebody decides they're going to take care of this, and they pull out a knife, and then someone pulls out a 22, and then a 38, and then a 45, and then my friend here decides he's going to solve it all, pulls out a shotgun. And everybody is duly impressed, except for the guy on the other side, who pulls out his semi-automatic weapon. Your bullets are big, but I can shoot more. So this guy does the first smart thing he's done in a very long time, and he runs. Now, he's not running like they taught him in his gun safety class as a part of gang initiation. Yeah, they don't have that. Tip up, safety on, come on guys. That's not the way that works. He's doing TV, movie, Terminator action. He's got that shotgun out there, finger on the trigger, no safety on, because why would you do that? And he's running. And he's swinging that thing around. I'll be back. And he's understandably a little nervous because they're shooting at him. And at some point he gets back in a position kind of like this and accidentally pulls the trigger and goes bang and shoots himself in the back of his own leg with his own shotgun, which is what you're seeing here. Now if you look clearly, there's some orientation. There's the back of his thigh, crease of his knee. That's his calf muscle. Then there's a hole. And then here's his heel and his foot goes this direction. If you're having a hard time seeing this, I'll give you a better view. Here's his knee, there's his shin, there's his foot, there's a big hole. Now, I will tell you, you are not born with that hole, and that is not a hole you want to have. That is a bad hole. There is something really important that used to go through that hole. Anybody know what used to go through there? Where are my athletes in the room? The tendon, a specific one. Bonus points. Achilles, your Achilles tendon goes through there. Very nice. Future doctors, I love it. You guys are awesome. Your Achilles tendon is what goes through. And the Achilles tendon is what attaches your calf muscle to your foot. It is what allows you to do this kind of motion by pulling down using that calf muscle, which is not important unless you want to, move. Because that's how we move. You move by pushing off of your back leg. And if you do not have an Achilles, you cannot push off of your back leg because there's nothing to hook up to the foot. So there is no universal Achilles donor bank that I can call and they're going to fly one in for me to replace it. Your parents are not going to donate theirs because they need it because they have to move. So it's just kind of gone. So we take this guy to surgery, we clean it out, we sew it up, we fit him with a brace in rehab that kind of keeps his ankle at 90 degrees. So the rest of his life he's going to walk by kind of throwing his hip out there like this and pushing his leg because he can't push off the back leg. So no more running, jumping, hopping, skipping, dancing, jumping, all of that sort of stuff, all over this really cool piece of sidewalk. Now that doesn't make a lot of sense to most of us. I totally understand that. And as far as I know, here in Fort Wayne, there's not a lot of gang warfare going on, at least as far as I'm aware. Homestead, represent. Nothing? As far as I know, I don't know, maybe. I don't live in Indianapolis. But as far as I know, there's not. However, we fight over stupid stuff all the time. Dude, that's my pencil. No, it's not. Yes, it is. Shut up. No. That's my folder. How do you know it's red? Mine too. Shut up. No way. That's my boyfriend. You can't look at my boyfriend like that. That's my man. Don't look at my man. Get up off my car. Why are you leaning in my car? We fight over stupid stuff all the time, and it cracks me up. The fact we're fighting over pencils. If you go to Costco, for $1.72, you get 734 pencils. And we're fighting because the dude has one. I don't even know what the cost of that one pencil is at that kind of thing. And the folder, if you spend the extra 5 cents, get strawberry shortcake on the front of that folder, no one will fight you for that folder. It is all yours. But my favorite is when we fight over boyfriends and girlfriends, and people looking at boyfriends and girlfriends. Oh, I love that. It cracks me up. Ladies, you do not know this. And as I say this to you, every guy in the room is going to pretend like they have no idea what I'm talking about, and they are lying. Because the first time a boy goes to ask out a young lady, it is a process. It is a process. This doesn't come naturally to us. It is overwhelming. It's scary. We have to think about this stuff. Now, it's a lot easier now because you guys have text. So you can kind of text in a phone, and then it goes to like the stexosphere, and then she goes, you want to go out? Yes. And then it comes back in the text. You're like, great. And it's really kind of generic and easy. I'm old. I'm like 734 years old. And when I was younger your age, we actually had to call her on the phone. And there were not cell phones. We had to call on a landline, which meant half the time I got the dad answering the phone. No, that ain't gonna happen. If I happened to get her, the first couple phone calls were along the lines of, oh my God, she answered. And then I hang up, right? And then I got to work through my head what I'm going to do to try and carry this thing off. So I had this cool dialogue, all this kind of stuff to make me sound kind of cool. And at the end, almost as though I was doing her a favor in some way, I would say, so if you want to go out or something, we could do that. That'd be cool, And then she would say yes. And now there's a whole new process, ladies. And this is where the guys kind of join me again, because now we got to think about things differently. And we got to decide, well, how am I going to look? Am I going to put product in my hair? Am I going to try and comb it up? Do I want the messy thing? Am I going to wear like a collared thing? Or am I going to wear a sleeveless shirt and show where the gun the show? What am I going to look like? And then I got to figure out, well, how am I going to get there? Because my car smells like a sweat sock, but I may borrow Dad's, but how am I going to do that? I'm going to have to pay Dad back. And then how am I going to pay for this whole thing? Do I have to get a job? Am I going to get a loan? Would Dad loan me some money to do this? There are all sorts of things. And then we pick you up, and we take you to the restaurant, and we excuse ourselves 5 times because we're sweating. Got a towel off, and we go, no, talked about that. Okay, talk about it. Go back in there, and then we take you to the movie theater, right? And this is rated G version because we're in school. And we get to the movie theater, and we get that big jumbo box of popcorn, right? You know what I'm talking about? We put it between the two of us. We both reach in at the same time. We're touching hands. Oh, you know what I'm talking about the first time you were digging that. So you're touching hands. You're all excited. And as we're walking out of the theater, some dude starts looking at her. So we're going to fight? After all of that, that's how fragile this is? I got to fight now because he's looking. Oh, it cracks me up. If I go to a club and some dude is checking out my wife, I am all for it. Yeah, she is hot. Look at that, right? Give him a spin. Show him your butt. Because if I'm lucky... he's going to buy her a beer and save me $6. Because what he doesn't understand is at the end of the night, you know what? She's going home with me. I could fight him. I guess I could. But I've already won. I don't know what I'm fighting about. It cracks me up. And usually instead of fighting, it's something along the lines of, hey man, thanks for the beer. And we leave. This whole thing is about choices. You can fight over anything you want with anybody you want to. But however, I want you to understand fights are different now. When you were in elementary school and Bobby stole your swing, no, you did not steal my swing, Bobby. Right? Because the worst thing that happens in elementary school is you get in some sort of, I'm going to get it, and then you end up in the principal's office and it goes on your permanent record. Whatever that is. I don't know what that is. It's on your permanent record that you were fighting over a swing. But when you get into high school and college and beyond, fights become different because you start mixing with the crazy people and you don't know who they are because they look just like you. And you don't believe that? Watch the news. They show all these people that are like kidnapping people and putting them in their basement and chopping it up and eating on a salad. They look just like you. They even talk to the neighbors. The neighbors are all like, oh yeah, he was really quiet, but he was such a nice boy. He used to mow my garden. He was eating people. No, not a nice person. You can't tell who these people are. So you have to think about fights differently. You have to think about fights in terms of, is this worth me being shot or stabbed over? Because that's exactly what can happen. You have to decide, and it's different for everyone. For me, if someone is physically threatening my children or my wife and putting them physically in danger, and I get shot or stabbed protecting my family, okay, don't misunderstand. I don't want to be shot or stabbed, but I'm the dad. That's kind of my gig. I signed up for this. If you were in trouble, you would expect your dad to come and help you because that's what we do. So if I get shot or stabbed protecting my kids, okay. But if you cut me in line at Kings Island, whatever. That doesn't bother me. This actually happened. I had a kid cut me in line at Kings Island, and he turned around and he was like, what? That's right. Like he had some amazing victory because he's standing there, right? And he turned around, his friends were all excited, and it was like this great victory in his head because in his head, he had just won something. The funny part is in my head, I was looking at this going, oh, that's adorable. He thinks he's a man because he's standing there. That's awesome. Get a mortgage. Then I'm impressed. All right? That doesn't make you a man. You get a mortgage, then we'll talk. All right? It doesn't matter to me. I don't care because the truth is I'm still going to get on the line. And if that's what makes you a man, in 2 minutes, I'm a man. It just doesn't matter. It's all about you and what you think is important. And you have to think about this stuff in advance because once you start bumping chests, it's on. It's not as though you can put that proverbial shotgun away. My bad. I didn't realize you were tougher than me. Sorry. That's not the way it works. Once you start, it's on. So you have to think about in advance, what's important to me? What am I worth? What's worth being shot or stabbed to me? And that's what you would be willing to fight for. But you have to think about it in advance. 4th of July. What? I love the 4th of July. I have to bust my own chops. When I was in high school, I thought it was a great idea to throw bottle rockets, which at most of the guys in the room know what I'm talking about, because bottle rockets are these big long sticks with this heavy thing at the end, and you can really wing those things because of the heavy part, and as it starts to go down, the bottle rocket kicks in, and it goes even farther, and then at the end, it goes bang. Is there anything more guy than that? I mean, it throws really far, and I made a noise. It's a very manly thing. And ladies, as I tell this, you are absolutely correct. It's so dumb. You're right, it is. It's totally stupid. However, when I was in high school, we thought this was pretty cool. So I remember this like it was yesterday, and again, I'm 734 years old. When we were in high school, I remember I was at Jason Randolph's house, and I was with Mike Murdoch. And Doc and I are winging these bottle rockets back and forth. And Doc turns to me and says, dude, shirt's on fire. Just about like that. Now, I would have expected a little bit more angst, but after all, it was not his shirt. So I look down, and there's a flame coming up the front of my shirt. So I put the thing out, and I look down, and I have a hole in the middle of my shirt. Now, as you can imagine, after watching me for this short period of time, I'm a tool. And I was a tool then, and I still am a tool. So I'm at a party with a hole in the middle of my shirt. This is not going to help me out any at all in this thing. I'm already a dork, and this is not even better. But that's not even the tragedy. The real tragedy in this story is that all four of those hairs that I have been raising since middle school, all four of my babies that I moisturized and cared for every single night, all four of my babies were gone like that. Now, ladies, you may not get this, but guys, you know what I'm talking about. The first time one of those bad boys appears, I'm a man. It's like, oh, I'm a man, I got hair, Mom. You know, it's an exciting thing. I had killed all four of my babies. Now, the good news is, I had the opportunity to learn from my mistakes. That's called wisdom. Intelligence is how smart you can process and all that sort of. Wisdom is your ability to learn from mistakes and things that are around you. I had enough wisdom to look back and say, okay, throwing bottle rockets is fun, but it killed my babies. And I don't think that's worth it. So I stopped throwing bottle rockets. And you'll be happy to know everything grew back in and I'm totally fine. However, you don't always get that chance. These guys thought it was a really great idea to throw M80s at each other. If you don't know what an M80 is, it's a firecracker. It's about this big. You can't write your name in the sky with pretty lights. It doesn't shoot up and blow up. It goes bang. That's it. Bang. Now, it explodes really loud. It's a loud bang. It explodes with the force of 1/5 of a stick of dynamite. So it's a loud bang, but it's just a bang. So he and his buddies are throwing them back and forth at each other, and he's got one lit up, and he's getting ready to throw it at his friend, and his friend ducks behind a tree. You don't want to waste a good M80, right? So he starts looking around, trying to find somebody else, and he's carrying that wick, and it's just burning away, and he's running around trying to find, until the wick burns out, and it goes bang, while he's holding on to it. And it blows off his thumb and his index finger. I'll give you another view. His thumb and his index finger. Now, I want to point something out in this that you may have missed. Beer belly. Beer belly. Might have had something to do with it, I'm just saying. However, he blows off his thumb and his index finger. This is a big deal, because your opposable thumb is what separates you from a lot of the animal kingdom. It's what allows you to turn a doorknob, button a button, zip a zipper, hold a pencil, shake a hand. You don't have an opposable thumb, you can't do this stuff. Now, I can fix a lot of stuff, and his friends were kind enough to pick up all the little finger lip pieces and put it in a bag and bring them to me, as though I could Expelliarmus or some sort of thing to make it happen. I can't fix that. There's no fix for that. So he just lost his thumb and his index finger, and he doesn't get it back. You don't always get the opportunity to learn from your mistakes. And the best part about it when you make a mistake is you don't even have to tell anybody that that was a mistake in your head. All you have to do is think about it, reflect upon it, and say, well, maybe this is not the best thing for me to do. Because you don't always get the chance. So it's important for when you make a mistake to look back at your behavior and try and adjust it so you don't make those sorts of mistakes again. Lawnmowers. I told you that there's two things I want you to get from this about alcohol. One is that it's a drug, and secondly is how it works. Now, I say this because this is a way oversimplification, I will tell you. The way that alcohol works is designed on the way that the brain is oriented, and this is a way overgeneralization. And if you understand this, you are ahead of 90% of the adults that you know, because most people don't get this. The way that the brain is organized is that on the very outer surface of the brain is your higher cortical function. That's your thought, your reason, your judgment, and your thought. That's the outer surface. As you get a little deeper, you get into the muscle function and the sensation and that sort of stuff. And you get a little deeper and deeper and deeper till you get to the center. And the center of your brain is the most protected part of your brain. It is the most important part. It is the blinking, digestion, urination, salivation, lacrimation, your eyes watering, all the stuff that you don't think about that just happens. And that's at the center of your brain. The way alcohol works is from the outside in. So the first thing that goes, the very first thing that's affected by alcohol is your judgment. And the problem is you can't tell. And the reason you can't tell is because you would be using your impaired judgment to judge your impairment. Oh, I'm saying that again. You are using your impaired judgment to judge your impairment, which is why you're going to go to a party someday with the person that drove you, and they're going to have a beer, 2 beers, 6 beers, doesn't matter, and you're going to want to ask them the question. You need not ask the question, because the answer is always the same. You're going to want to ask them, dude, are you okay to drive? Right? That's what everybody wants to know. And they are always going to say, I'm fine. Because in their mind, everything is working perfectly. Because they're using their impaired judgment to judge their impairment. They will always say they're okay. But the reality is, alcohol and machines, they don't mix. Because machines do what they're supposed to do, and you are in charge of the machine. So if you are not thinking and using good judgment, that is how bad things happen with machines. This guy is a perfect example. The guy I'm going to show you is a very successful attorney in the city of Chicago. A really smart man who does a really dumb thing. He comes home from work one day and his wife says, I need you to mow the grass, and like every good husband he says, yes dear. So he goes out to mow the grass, only it's a hot day, and he's bought into that multi-billion-dollar advertising campaign that alcohol is somehow the perfect beverage. It keeps you cool in the summer and warm in the winter. So he decides, I'm going to have one ice-cold refreshing beer before I go out and mow the grass, and he has one. The only way I know that he had a beer is because he said, I had a beer before I went out and mowed the grass. He was not slobbering drunk. I couldn't smell it on his breath. He was not slurring his speech. He was not staggering around the department. The only way I know that he had a beer is because he said, I had a beer before I went out and mowed the grass. So he goes out and he mows the grass, and as he's pushing it along, he runs over a branch that's about this big around. Now, under normal circumstances, when you jam up the mower blade with a branch, if you walked by, I would say, hey, listen, would you grab that branch out from under the lawnmower for me? And you would say, no, because there's a spinning, sharp metal thing under there that is bad for us. But this guy has had a beer. And the first thing that goes is your judgment. So he starts thinking to himself, you know what, I'm a pretty fast guy. If I come from the side, I bet I could grab a hold of that thing and be out before it, gets a problem. So he reaches down under there, grabs a hold of the branch, and sadly he pulls it out and is very successful. Frees up the mower blade, but he's not as fast as he thought he was, and it swings around and takes the tip of his 2 fingers off here, which is what you're looking. Now this is not the worst thing you're ever going to see, but think about this for a second. This is an attorney, and the only thing an attorney does more than talk is probably write. And 2 of the 3 fingers you would use to hold a pencil or a pen are permanently gone. I can't put that back on. It's just gone. So he is now going to be Stubby the attorney guy for the rest of his life. So the first time he meets a new client, nice to meet you. Oh, no. I'm not shaking that. No. For the rest of his life. You don't get that kind of stuff back. The first thing that goes is your judgment. And you don't want to make an error with machines because they're very unforgiving. Alcohol and any machine that is. Now this next one's pretty gross, so I'll give you a warning here. This guy is a farmer. His dad was a farmer. His dad's dad was a farmer. His dad's dad was a farmer. This guy knows more about farming than really anybody I know. And he was doing everything right. He was working in a grain auger. Now, I don't know if you know what a grain auger is, but it's a great big bin. And at the bottom of it, there's this trench. And in this trench, there's this metal spiral macaroni thing that's hooked up to a motor. You turn that motor on, it turns the winch, and it clears out all of the grain out of the grain auger. So he's down there doing everything right. He's got his gloves, his goggles, his tight-fitting clothes, his boots, and he's in the grain auger, and he's knocking the very last of the grain down into the auger. And for one split second, one time, he's not paying attention to what he's doing. One split second, one time. Now, he's done this 734 million times before and never had a problem. This one time he's not paying attention, and as he knocks it down, his tip of his glove gets a little too close to the auger, and it gets caught. Now, it's a machine. It doesn't think, it doesn't react, oh my gosh, it's his. It just continues to go, and it pulled his glove off. And just like in the wintertime, when you try to take your gloves off in a hurry, how it doesn't work, they get stuck. Same thing happened on this guy's hand right there. and it pulled the glove off with everything else inside, which is what you're looking. You see his thumb here, it's completely disarticulated. It should be attached right there. His index finger only has an extensor tendon still working. These two fingers are completely crushed with no blood supply. If you look at the nail bed, they're white. If you look at yours, they're pink. If you push on your nail bed, it becomes white, and as soon as you let go, within 3 to 4 seconds, it should become pink again. That's because you have a good blood supply. This guy did not. It was white all the way through. And his pinky was still intact, so when we took him to surgery, we ended up with this kind of fisty thing. We were able to save the pinky. It was so badly damaged that we had to take a flap of the femoral artery and run it up through this little plastic tube just so his hand would have enough blood supply to heal. That's how badly damaged this thing was. Now eventually he actually lost the pinky too, and he just kind of ended up with this fist thing. Now I'm aware that most of you are not going to be working grain augers. I mean, maybe you are, but most of you probably are not. But for the rest of you, if you have not already, you will very soon be operating a big deadly piece of machinery on a regular basis. But we don't think about it as a big deadly piece of machinery because they've got really tight rims and kicking stereos, and sometimes the top comes down and all that. But your car is a big deadly mobile death trap. Kills thousands upon thousands of people every day. It is a mobile death trap, and when you get your driver's license, if you don't have it already, it is one of the greatest freedoms you are ever going to have. And I am excited for every single one of you, because for the first time in your life, if you get into trouble, you can actually leave and save yourself. You can take care of yourself. However, it is also a huge responsibility because you are now in charge of this big mobile death trap that kills people. And it takes one split second, one time. I had a guy several years ago that I walked in to the room. He was a machinist. Great big guy. He's like 65 or something. And he worked in a factory all day. And all he did was punch steel. Steel would come in, he'd take this thing and hammer it down. It would mold the steel, and then the next would go out. For 12 hours a day, he's punching steel like this. So this is a great big man. And I walk in the room, and the guy is sitting there, and he's crying. Now, I'm not talking about like a little tear. I'm talking about sobbing. And I'm thinking, whew, this is going to be intense. I wonder what this is all about. So as I walk in there, I say, so what's going on? Now, the reason he was crying like this is because he hadn't been able to sleep. 2 weeks before that, he was coming home from work, and he'd been working all day, and he was tired, and he wasn't really paying attention. And as he was going through his neighborhood, he was kind of on autopilot. He was just kind of zoned out, not really paying attention. And as he was going through the neighborhood, it was the same time that his next-door neighbor's kid, who was 6, was playing hide and seek. Now, you can remember playing hide and seek when you were a kid. When you get discovered, what do? You run. Now, you can tell a kid 1,000 times, don't run in the street, and they get that, but when they're in the middle of the game, they don't pay attention, they're 6. So he takes off and he starts running. And the reason this guy was in my department was because he hadn't been able to sleep for the last 2 weeks, because every time he closed his eyes, all he could see was his next door neighbor's face as he turned and looked him in the eyeballs right before he mowed him over and killed him. Now, this is not TV movies, this is real. This is a kid that he watched come home from the hospital when he was born. He has seen every one of this kid's birthday parties. He used to play in his swing set in his backyard. He loved this kid. The last thing he would ever want to do was to hurt this kid. But for one split second, one time, he was not paying attention to what was going on, and he killed his next door neighbor's kid. There is not medication that makes that okay. There's not enough psychotherapy in the world to make that okay. That is a scar that lives with you forever. And I would not wish that on any one of you. I wouldn't wish that on my worst enemy, because that doesn't ever get better. It takes one split second, one time when you're working that machinery for it to be a mistake that you don't get back. You may get away with texting and driving 10,000 times, but that 10,001 when you hit that kid, that's it. You don't get better from that. That's forever. And I bring up texting for a specific reason. If you look at your texts, they don't go away. They're not going to disintegrate. If you're driving, they're not going to be gone when you get wherever you're going. They're still going to be there. And most of them, if you check them out, are simple stuff like what you're doing, what you're wearing, where you're going, that kind of stuff. They don't have to be answered right this very moment. They can get where you're going. Now, we're not in Indianapolis because I can't really say this, but my kids in Indianapolis, I practice what I preach. I don't text and drive. It's not worth it to me. I wait till I'm getting there. Even an old guy like me, I get texts, but I don't answer it. If I'm with somebody in the car, I'll have them read it to me. They can answer it for me, whatever. But if I'm by myself, I just wait till I get wherever I'm going, because it's not worth it to me. It takes one split second, one time, and you don't get that kind of stuff back. That's forever. There's 2 people in this story, and I'll explain what you're looking at here in a minute. There's 2 people. Am I running out of time? Can I finish this one? I'll finish this one story. Okay, there's two people in this. A 33-year-old father of three. He comes home from work one day. Wife says, I need you to go to the grocery store. He says, yes, dear. He's got his car parked, and he's unloading groceries out of the back of the car. The other person I'm talking about is a diabetic guy who's been checking his blood sugar, and at 60-something years old, he decides he doesn't want to do it anymore. After all, it's his body, and he decides, I don't want to do it anymore, so he does it. So he stops checking his blood sugar. Now, he's coming home one day after not checking his blood sugar, and he passes out. Again, not sleeping, unconscious. And he falls asleep. He basically passes out like this, with his chest on the steering wheel, fully on the accelerator. He's unconscious as he goes careening through 3 stop signs in a neighborhood, and he comes to a stop by hitting the back end of this guy's parked car who is unloading groceries. And at 70 miles an hour, there's no time to move. He gets hit from behind. What you're looking at here is, here's his waist, his right leg, his left leg comes down here, and his left leg is amputated. It's cut off on the street. This guy bleeds to death in the street. They bring me both of these gentlemen, which you can see, he comes in here, and we try all sorts of stuff to get this guy back. This guy dies. The other guy goes to surgery, he loses his spleen, does some other stuff, and I get to wake him up several weeks later and say, by the way, you killed somebody. Now, this is not TV or movies, this is the real deal. He never planned on this because this was supposed to be something that affected him and his body. And he lived in a world where he didn't think of us as animals. Whether we want to think about it or not, we're all interconnected. Everything we do and say has an impact on everyone around us. And it's our choice about how we want to be in this world. Now, I had a kid several years ago that came and he had decided that morning he was going to kill himself. He got every pill in the house and he lined it up on the dresser. He went to school that day, and at study hall he wrote the note. And his plan was he was going to come home, put the note on the kitchen table, go upstairs, take all the pills, lay down in the bed. When Mom came home, she was going to find the note, go up and see him dead in the bed. That was the plan. So he's in study hall, he's written the note, he's walking out to go to the bus to go home and do this, to kill himself. And on his way out to the bus, he walks by a kid that, as it turns out, is just an acquaintance. It's not somebody he's really friends with. He walks by this kid that he kind of knows, and the kid goes, hey man, what's up? That's it. He gets on the bus, and the whole way home, he's thinking to himself, you know what, someone actually acknowledged my existence on the planet today, and if I do this, someone might miss me. So he goes home, he takes the note out, he puts it on the table, but instead of going upstairs, he sits down next to that note. And he just waits. Mom comes home, reads the note, realizes he's in trouble, gets him to us. We get the kid to the stress center, we get him treated for depression, and he does great. He does great. There's an interesting kid in this story. There's a kid in this story that literally saved his life. Literally saved his life. Think he has any idea? All he did was say, hey man, what's up? How many times a day do you walk down the hall and say, hey, what's up? My point is, you have no idea how you affect everybody around you. That kid that's not as cool as you, as tall as you, as fast as you, as smart as you, as athletic as you, doesn't dress as well, not as good looking. You have no idea the effect you have on everybody around you, but you have an effect on everyone around you, and it is your choice. You can be a positive force in this world, or you can be a negative force in this world. And part of the reason I'm here is because I don't get paid for this. I could be at home sitting on watching TV. Because I choose to try and be a positive force in this world, and it's your choice what you want to do. You can do anything. It is all about choices. I'll show one more picture of his leg. You can see his right leg here and there, and then I'll get you guys out of here because you all have to leave. I appreciate your time. I don't think there's anything else. Just some quick. One more story. Look at my camera. There we are.
Thanks, Stacey, for 30 more seconds, please. I need your attention after you give a bigger round of applause for Dr. Gaffney.